Schizophrenia is a serious mental illness. It affects how a person thinks, feels, and behaves. People with schizophrenia may seem like they have lost touch with reality. This can be distressing for them and their loved ones. Imagine a world where thoughts become jumbled and voices whisper secrets that only you can hear. This is the perplexing reality for millions worldwide grappling with schizophrenia. It's a chronic and severe mental disorder that disrupts a person's ability to think, feel, and behave clearly. This essay delves into the depths of schizophrenia, exploring its causes, symptoms, and potential treatments. We'll embark on a journey to understand this complex condition, shedding light on the challenges faced by those affected and their families. Join us as we unravel the intricacies of schizophrenia, seeking to foster empathy and understanding for those navigating its complexities. Our aim is to provide a comprehensive guide to this often misunderstood illness, offering insights into its management and the hope that lies in both conventional and alternative approaches. The exact causes of schizophrenia are still unknown. However, research suggests that a combination of genetic and environmental factors plays a role. Genes make some individuals more vulnerable to developing schizophrenia. Imagine a puzzle with missing pieces, each piece representing a factor contributing to schizophrenia. Genetics, like a cornerstone, lays the foundation, making certain individuals more susceptible. But genes alone don't paint the whole picture. Environmental factors like early childhood experiences, exposure to viruses, and substance abuse act as triggers, potentially activating the dormant vulnerability within the genes. It's the interplay of these elements that likely tips the balance, leading to the development of schizophrenia. Think of it like a recipe for a cake. You need the right ingredients in the right proportions for the cake to rise. Similarly, schizophrenia likely arises from a complex interaction of genetic predisposition and environmental influences. Schizophrenia affects the brain's structure and function. It disrupts the balance of chemicals called neurotransmitters, which are responsible for communication between brain cells. This disruption leads to the various symptoms of schizophrenia. Imagine the brain as a complex network of roads and highways, with neurotransmitters acting as the vehicles carrying messages between different areas. In schizophrenia, these roads become congested and the flow of traffic is disrupted, leading to communication breakdowns within the brain. One prominent theory suggests an imbalance in the neurotransmitter dopamine, responsible for pleasure, motivation, and movement. Excessive dopamine activity in certain brain regions might explain the hallucinations and delusions experienced by individuals with schizophrenia. Furthermore, structural abnormalities in the brain, such as enlarged ventricles, fluid-filled spaces, and reduced grey matter, brain cells involved in processing information, have been observed in people with schizophrenia. These alterations further contribute to the cognitive and emotional disturbances characteristic of the illness. Schizophrenia manifests in a variety of ways, with symptoms often grouped into three categories: positive, negative, and cognitive. Positive symptoms are additions to normal behavior, negative symptoms are reductions in normal behavior, and cognitive symptoms affect thinking and memory. Positive symptoms, like hallucinations, delusions, and disorganized thinking, are often the most noticeable. Hallucinations involve perceiving things that are not real, such as hearing voices or seeing visions. Delusions are firmly held beliefs that are not based on reality, like believing one is being followed or controlled. Negative symptoms like apathy, social withdrawal, and lack of motivation can be more subtle but equally debilitating. Imagine feeling emotionally numb, losing interest in activities you once enjoyed, and struggling to find the energy to engage with the world around you. Cognitive symptoms, such as difficulty concentrating, impaired memory, and problems with executive functioning, planning, and decision-making, significantly impact daily life. It's like trying to navigate a maze with a foggy mind, making it challenging to learn, work, and maintain relationships. Section 5. Shining a light diagnosis of schizophrenia. Diagnosing schizophrenia involves a comprehensive evaluation, including a physical exam, a psychiatric assessment, and ruling out other medical conditions that could be causing the symptoms. There's no single test to confirm schizophrenia. It's a diagnosis of exclusion. Think of it like a detective piecing together clues to solve a mystery. The doctor acts as the detective, gathering information from various sources to arrive at an accurate diagnosis. The patient's medical history, family history of mental illness, and current symptoms provide crucial clues. The psychiatric assessment involves a detailed interview where the doctor asks about the patient's thoughts, feelings, and behaviors. Standardized questionnaires and rating scales may be used to assess the severity of symptoms and track progress over time. Laboratory tests, such as blood tests and brain imaging scans like MRI and CT, may be conducted to rule out other medical causes for the symptoms, such as thyroid disorders, drug use, or brain tumors. It's like eliminating suspects from a lineup until only the true culprit remains. Section 6. The unfolding storm complications of untreated schizophrenia. If left untreated, schizophrenia can have severe consequences affecting various aspects of an individual's life. It's like a storm brewing, with the potential to cause significant damage if not addressed promptly and effectively. Untreated schizophrenia can lead to social isolation and strained relationships as the illness makes it difficult to maintain connections with others. The stigma associated with mental illness can further exacerbate isolation, creating a vicious cycle of withdrawal and loneliness. The cognitive impairments caused by schizophrenia can make it challenging to hold a job or pursue education, leading to unemployment and financial instability. This, in turn, can contribute to stress, anxiety, and a sense of hopelessness. Furthermore, untreated schizophrenia increases the risk of self-harm, substance abuse, and suicide. It's crucial to seek help and support as early as possible to mitigate these risks and improve the individual's overall well-being. Section 7. Navigating the labyrinth general management of schizophrenia. Managing schizophrenia is a lifelong journey that requires a multifaceted approach, often involving a combination of medication, therapy, and lifestyle changes. It's like navigating a labyrinth, requiring patience, persistence, and a supportive team to guide the way. Antipsychotic medications are the cornerstone of schizophrenia treatment, helping to reduce the severity of positive symptoms such as hallucinations and delusions. These medications work by blocking the action of dopamine in the brain, restoring neurochemical balance. Psychotherapy, such as cognitive behavioral therapy, can help individuals identify and change negative thought patterns and develop coping mechanisms for managing their symptoms. It's like learning a new set of skills to navigate the challenges posed by schizophrenia. Lifestyle changes, such as getting enough sleep, eating a healthy diet, exercising regularly, and avoiding alcohol and drugs, can also play a significant role in managing schizophrenia. These changes promote overall well-being and support the effectiveness of other treatments. Section 8. A holistic approach, homeopathic management of schizophrenia. Homeopathy, a system of alternative medicine, offers a holistic approach to managing schizophrenia. It emphasizes individualized treatment based on the principle of like cures like, using highly diluted substances to stimulate the body's natural healing abilities. Homeopathic remedies for schizophrenia are chosen based on the individual's unique symptom picture, taking into account their mental, emotional, and physical characteristics. It's like finding the missing piece of a puzzle that completes the picture of the individual's health. While homeopathy should not be considered a replacement for conventional treatment, it can be used as a complementary therapy to support overall well-being and address specific symptoms. It's essential to consult with a qualified homeopathic practitioner for personalized treatment. It's important to note that scientific evidence supporting the effectiveness of homeopathy for schizophrenia is limited, and further research is needed to establish its efficacy. However, many individuals with schizophrenia find homeopathy to be a valuable adjunct to their conventional treatment plan. Section 9. Conclusion: a beacon of hope. Schizophrenia is a complex and challenging mental illness that can significantly impact an individual's life. However, with proper diagnosis, treatment, and support, individuals with schizophrenia can lead meaningful and fulfilling lives. Early intervention is crucial in improving long-term outcomes, and a combination of medication, therapy, and lifestyle changes can effectively manage symptoms and enhance quality of life. It's like providing a sturdy ship and a skilled crew to navigate the choppy waters of schizophrenia. While there is no one-size-fits-all approach to managing schizophrenia, Understanding the illness, seeking professional help, and building a strong support system are essential steps towards recovery. It's a journey that requires patience, perseverance, and a belief in the possibility of a brighter future. Let us remember that behind the diagnosis of schizophrenia lies a human being with their own unique strengths, dreams, and aspirations. By fostering empathy, understanding, and support, we can empower individuals with schizophrenia to live their lives to the fullest.